VCMG Live is not responsible for any content, information, or opinions expressed. User bears full responsibility for their reliance on such content, information, or opinions.
Amp2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Welcome back to another episode of You and Your Doctor, sponsored by All County Healthcare. We are a certified home health care agency servicing Palm Beach County, Broward, and Miami-Dade. You can connect with us at 954-717-7027. I am delighted to introduce everybody to our guest today, Dr. Jeff Steinberg, and he's right here in Plantation. The address is 130 South University Drive, Suite C, right here at Plantation, Florida, 33324. And the website is www.drjeffsteinberg.com. And he is board certified in neurology with a fellowship training in pain management and sleep medicine, and also nerve study testing. We get to talk about that too. Well, thanks for coming to the show.
It's my pleasure. Thank you for having me.
I appreciate you taking time out of your schedule. I know how busy doctors are and your schedule and everything going on. I know that you're busy, so thank you for coming out and doing this. And I always usually like to get a little background information. If you could just share with us a little bit, where did you study and what made you want to go down the path of neurology?
Well, I'm from New York, and I went to medical school in Grenada in the Caribbean.
Oh, nice.
Yeah, and my grades weren't that good at the time, but I really wanted to be a doctor.
Nice.
And it gave me that opportunity. So from there, just started doing training and finding what would interest me. And then I just found neurology gravitated to me at the time. Mm-hmm. It was a more creative field. You know, it's as I say, it's the last frontier of medicine, right?
I like that.
We know about the heart, we know how to transplant the liver, we know about the kidney, but we still don't know about the brain and the mind. So I found that fascinating, and I just started getting into that. So then I wound up doing a sleep and EEG fellowship. I did a nerve conduction study fellowship in case people have nerve damage, and then I wound up doing a pain fellowship.
So let's talk about, I'm interested in that nerve study fellowship. So what type of people would qualify for a nerve study? What type of patients?
Yeah, well, anyone who presents with any sort of numbness, tingling, weakness, anyone who has any pain. So we try to figure out what it is. So I consider myself a medical electrician.
Oh,
right?
I like that.
Right. So the brain is either the fuse box,
okay,
right, like in your home, and the spinal cord is the housing unit.
Okay.
The spine is the housing unit for the spinal cord, and then all the little home runs. If it runs down out to the neck, it takes the numbness or tingling in the hand. So you can have a pinched nerve causing that numbness, or carpal tunnel, and the nerves can help differentiate that.
Okay.
So that's how it helps. Or if you have diabetes and you have a pinched nerve, so these nerves travel. They can travel to the organs, or they travel to the muscles, the innervatum, or sensation. So that's where the nerve study test comes in, and it really is an important diagnostic test. And why I like it, I still believe in helping the people, and it's still the clinical diagnosis. A test should only confirm or deny what you think clinically. So
interesting. I've heard of people with diabetes having neuropathy. Is that nerve damage in the feet?
Yes, exactly.
Okay.
So neuro means nerve, and apathy is pathology of. So think of it as like at the wires, if they get frayed.
Yes.
That's what diabetic neuropathy, or any type of peripheral, meaning distal neuropathy, nerve damage. Then you have to figure out what it is. And then, once you figure that out, make sure it's nothing else, then how do you treat them with that?
Yeah, that sounds painful. How does one get treated for that? Is it regulating their diabetes and other factors involved?
Yeah, so obviously controlling your sugars is important, and obviously if you don't control them, it'll get worse. If you can control it, it doesn't guarantee that it'll reverse it.
Okay.
So what I do a lot, because again, not only are the ends of the nerves damaged, but the circulation distally to the toes and feet are damaged too. And the nerves and the arteries work hand in hand. So if the nerve is damaged, your arteries are not going to work well. So I tell people, besides that, is a lot of nutrients. Massage oil, because massage oil has vitamins in it, right?
Okay.
So that's what the body needs. That's what the tissues need.
Oh,
and then I give them some vitamins first. Then there's specific ones I give. And then if it doesn't work and they're still in pain, then I try to find out how to mitigate the pain without medicine or with medicine, because the goal is to be functional, right? You can never cure, and you cannot guarantee you can cure pain.
Right.
Whether it's a slipped disc, head trauma. But my goal is to make them functional and enjoyable, and trying to make the pain part of their lives and not the pain overwhelm their lives.
Yeah, like manageable, I guess,
Right.
right? Yeah.
Right. And then again, I also empower them, because, like I said, I'm their advocate.
I like
and,
that.
And I got to help them on their journey. So I encourage them. They have to do things too. They
Right.
don't depend just on the medicine or the doctor.
Right.
But to educate them, so then they can go and take care of themselves. Like a little trick I use is a TENS unit. So a TENS
What is
unit.
that?
So it stands for Trans-Electrical Neurostimulator. So like if you ever gone for physical therapy, they put the pads on
Oh,
you.
yes.
But you can put it on your feet, for example, for
Okay.
circulation.
Oh, interesting.
Yeah, and now that's $50 on Amazon. You can go to some doctor or buy some high-end fancy equipment, but that's sometimes all you need.
Right.
Try the basic first.
Exactly. I like that. What about your the sleep medicine? So, can you share with us what type of patients show up, and what type of testing do you do, and what are the different variables?
Yeah. Usually people don't come saying I have a sleep problem. They usually
Okay.
say I'm fatigued or I have other issues.
Okay.
Right? Unless you have sleep apnea. Then it's usually the spouse, because most of them have sleep
right.
apnea. And they go, my husband snores and wakes up and he's tired.
Yeah.
So a lot of times, I'll see people come in for other reasons, and then they'll tell me I can't sleep.
Okay.
And insomnia is a huge, huge problem.
Right.
Right? So I will begin to ask them, for example, if people have Parkinson's, they may not sleep well. They'll have certain sleep problems.
Okay.
Or someone with chronic pain, they may not sleep well. But sleep is essential, right? It helps you healing.
Right.
Right? You need healthy sleep. For example, with the diabetics, if they have sleep problems, insulin is sleep dependent. So if they don't sleep well,
Interesting.
next thing you know, they have a problem. So there's actually studies showing that people with uncontrolled sleep apnea can have diabetic neuropathy.
Interesting.
And if you control the sleep apnea, then they can lower their insulin. Insulin becomes more stable, and then that helps regulate their sugar better. And you can't lose weight if you have chronic insomnia like sleep apnea. So it's a vicious cycle.
And everything's so interconnected,
It
right?
is, isn't it? Yeah.
Well, when someone goes to see you and they present with all these different issues and challenges, you see the correlation, which is
Right.
great, because then you'll know how to help them, because I know that you see different types of patients. So do you recommend sleep studies for them that they do at home, or how does that work?
Well, first, it's time intensive, because you have to figure out, do they have problems falling asleep, staying asleep,
Oh, wow.
getting up early, and how do they
Right.
feel in the daytime?
Okay.
So that's all those 4 different
Factors.
differential type of causes for those different types or subsets of insomnia. So I first talk to them and see what they're taking. For example, people sometimes may just be very anxious, and they'll take a Xanax, but they think a lot before they go to sleep, so they take a Xanax. The problem with Xanax is that it'll help you fall asleep, but you wake up in the middle of the night like that. And people don't realize. They go, I'm waking up. I go, take my Xanax. So then they take more Xanax.
I
So because
see.
they don't know.
Right.
So I explain to them how to do it. So there's a lot of just communication and education to let them know. There's also websites, you can go on YouTube, but it's good for them to hear it from me, so I can explain to them. And then I try some herbal stuff first, see how that works.
Interesting. I like that. Okay, good.
Yeah.
So you do recommend some herbal things, and people are open to that.
Well, sure. Think about it. Like sleepy time tea, really it's a plant. They're herbs. There's
Yeah.
really no complications.
Right. Chamomile or whatever.
Right,
else.
chamomile. Right, and then melatonin. Sometimes it works, and sometimes they don't realize how to take it. There's a way to take it properly.
Okay.
So then, if they don't realize it, but yet it works. So they'll say, oh, wait, take it helps me stay asleep, but I wake up groggy. You have to take it 2 to 4 hours before sleep because it mimics a neurotransmitter called melatonin in your brain. So that's how you have to do that.
Good to know.
Right.
2 to
4 hours.
2 to 4 hours prior to sleep.
Right.
Melatonin, and that's a natural thing that people can just
Right.
purchase,
Yeah.
out drugstore, whatever. Oh, that's good. And I know you see patients that come in, maybe they had a car accident or they have an injury,
Right.
and so they present with different pains, and how does that work? What would you suggest for them, or how do you treat them?
Yeah. Well, I look at it no matter whether it's from a work-related injury, a car accident, or just life. They're still in pain, right?
Yeah.
We label it as pain,
Right.
but we have to figure out what that pain does and how does it exacerbate your lifestyle. Like if you're in so much pain you can't walk, well then we have to figure out how you have to exercise, and you can't let pain control you, right? And then what kind of pain? For example, some people when they get in a lot of pain, they get anxious, right?
Right.
So they may take a pill for their anxiety.
Right.
So I tell them, I go, you have to understand when is your anxiety causing your pain and when is your pain causing anxiety.
I love that. You said that before. Can you repeat that? Because there's a lot of people that need to hear that.
Right.
Can you say that again? When is your pain causing anxiety, and when is your anxiety causing your pain? Because
Exactly.
people didn't realize that that's correlated.
Right. And they don't know,
Right.
but they just know they're in pain. And then next thing, but they're so used to the pain, they've just realized that because it's chronic, that they just say, oh, I'm anxious. They don't know why they're anxious. If you're in chronic pain, you don't sleep well, you're irritable. So, and like I said, it doesn't matter where it's from, whether it's a car accident or not, you still have to treat these people.
Right. Right.
So it takes time.
Of course. And of course, I'm going to ask you, do you accept insurance?
Yes, I accept pretty much all insurances.
Okay, good.
I don't accept Medicaid.
Okay.
And I also obviously take patients who have cash. But,
Of course, sure.
but like I said, and that's also some of the battles too, that a lot of insurance companies won't pay for certain medications that are essential. Like, for example, they may not approve Vyvanse for ADD, or like I do Botox for people with chronic migraines or what we call cervical dystonia, severe
is
neck
that?
stiffness.
Okay.
So it's just like your neck is in a locked position,
Oh, wow.
and it's painful. And if you're in a locked position and you try to move,
Right.
your eyes, your ears, and your senses and your neck all work as one. So if your neck is out of position,
Right.
you're going to start feeling dizzy.
Oh, wow.
And then if you start feeling dizzy, they're going to fall down. And then they may say, "Oh, I got dizziness, and I'm getting what we call vestibular therapy, dizzy therapy." But it's really coming from their neck. So, but if they have to find the doctor that would know that.
Right.
But they just say they're dizzy, so now they're taking something for the dizziness and not the neck stiffness. So I prescribe Botox, but a lot of insurances don't cover it.
So does it unlock what does the Botox actually do for the muscle, or what does it do for the treatment? For
So
the area?
Botox actually just paralyzes the nerve temporarily.
Okay, right.
So, and what they found, actually, the way they discovered Botox was children who were eating the honey pies, on the windowsill, and they would ferment and they would get bacteria because it was back on the windowsill back in the day. It wasn't refrigerated, and they would get respiratory paralysis. They couldn't breathe. It would be temporary.
Right.
But out of that, they discovered that you can use Botox to help for muscle stiffness. So we use it for muscle stiffness, and we use it for migraines.
Oh,
and it works
interesting.
really well.
Wow. We have a quick commercial break.
Okay.
We'll be right back. We'll continue that conversation.
All County Healthcare has exciting news for any and all patients with COPD or other respiratory ailments. Listen to what renowned pulmonologist Dr. Keith Robinson has to say.
Hello, I'm Dr. Keith Robinson, board-certified pulmonologist, medical director at Fusion Health Pulmonary Rehabilitation, and a board member with the American Lung Association of South Florida. We have exciting news for patients with COPD. We now offer IPV therapy at home, which has been demonstrated to improve airway clearance, decrease hospitalization, and improve quality of life of patients with COPD. Please call All County Healthcare for more information about this FDA-approved therapy.
For further information, call All County Healthcare now at 954-717-7027. That is 954-717-7027. Or visit our website at allcountyhealthcare.com. You can also find us on Facebook, YouTube, Twitter, Instagram, and LinkedIn. Remember, All County Healthcare always puts the patient's needs first. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Thank you for tuning back in to You and Your Doctor. We are interviewing today Dr. Jeff Steinberg. You can reach him at 954-900-6699. He's right here in Plantation, and the address is 130 South University Drive, Suite C, Plantation, Florida 33324. And you can also look up his website, www.drjeffsteinberg.com. And I am enjoying this conversation, Dr. Jeff. We were talking about Botox for the challenges with the neck, and what else are you using Botox for in your practice?
Well, my practice is the Headache and Pain Center of South Florida, so I do a lot of Botox for migraines.
Okay.
And
yes.
it really is a game changer. And there's certain criteria that you need to get it approved by insurance companies, but typically there's a lot of people who have migraines also have some component of neck stiffness, and they may have a little bit of grinding their teeth bruxism. So I look at all that. So when I look at someone with migraines, it's not just migraines. Migraines, by the way, is the 6th most disabling disease of a person's lifetime.
So I have a silly question. What is the definition of a migraine? Like, how can I distinguish between I'm having a migraine or I'm having just a headache? Like, is there a distinction?
Yes. So migraine, by definition, is a throbbing or pulsating headache, usually on one side as opposed to the other, lasting more than 3 hours, and it's either associated with nausea and vomiting or light and noise sensitivity. That's it. That's a very simple definition. So that is not so difficult. The question is, it's like when the storms come in Florida. How do I know? How do I know when a migraine's coming? And then when the migraine comes, sometimes they're mild, like a little rainstorm. Sometimes they're Hurricane 5. Cat 5 hurricanes, and those are brutal, and they are disabling. Some people have them where they can last up to like 2 to 5 days. So you can miss work, taking care of your family. It's very disabling. And think about it, if you just have 3 migraines and they last 3 days each, that's about 9-10 days. That's a third of your life every month that you're disabled to some extent. Now one day you may be totally disabled, and the other days you're just dragging, you're sick, you can't think well. I mean, all this, just think about it as like your brain just got a cold freeze. So you can't think well, you can feel dizzy, you get nauseous, and it's disabling. So people have to be able to identify it, and then also what contributes to it. So, for example, there's a neck problem. One of my biggest culprits that I see, that just educating them, is getting them off Tylenol and Excedrin. Because they call it...
Very easy to get hooked on that, right?
Right, because you say, well, I took the migraine, and it worked a little bit, and I could function, but doesn't get rid of it. So they go, all right, I got it again, or it didn't go away, I keep taking it. They can take up to 10, 15 Tylenol a week, and what it does is cause rebound headaches. So it exacerbates, it's like I tell them it's adding oil to a fire. So now their migraines were maybe three a month, but now they're getting headaches, including migraines, 20 days out of the month. A lot. So I got to get them off stuff first. And then maybe they got the neck problems, or they're grinding their teeth. So I tell them to either go to dentist or get mouth guard. I'll send them to an acupuncturist, a chiropractor to work hand in hand. But as long as they know what's going on, now they're in control of their migraines, because it's so disabling. And like I said, some pharmaceutical companies only give you 6 pills of a medicine that works. But you get, if you take 2 per migraine, and you get 4 a month, you're hoarding them. You don't know when the next bad migraine is. And this one wasn't so bad. And that's where the Botox come in, and there's other preventive medicines that you can do that it lessens the intensity and frequency. Some of them work so well that if it wears off after about 10, 12 weeks. So if I'm on vacation on the 12th, 13th week, they don't like me. Because the migraines are coming back. Right, so
And I imagine everybody has them for different reasons. Some people get cluster headaches. What is that? What's the difference between a cluster headache? I've heard that term before.
Right, so there used to be cluster headaches, migraines, and now there's something called cluster migraines.
Oh, okay.
So the cluster headaches were typically where they would occur seasonally, like once a year, like during springtime or during summertime, or once every few years.
Okay.
And when you get them, they just don't break. They just keep
Back to back.
on and on for like months. And you try everything.
So is that related to maybe pollen or allergy to something?
We don't know the exact mechanism as why that happens, but it does happen. When it happens, sometimes you have to give them oxygen, you give them some medications. I mean, oxygen actually helps for that. But then people can have cluster migraines, meaning that the migraines just occur in clusters and then they may not get them for a few weeks. And that's where I said it's time intensive, because you have to know what is it about that time. Obviously, with women during their cycle, that's one of the worst migraines is right during the menses. And it's like it's brutal. Those are usually the worst. So then you have to, okay, how do we deal with those? And then you go into the other part. So it's an ongoing process.
Yeah, it's a discovery, right?
Right.
I think you find that fun, or I get the feeling that you find it interesting to try to decipher what, you know.
Well, people come in throwing up, they're dizzy.
Wow.
So sometimes I'll even give it, we can give them IV vitamins, because that'll help pretty quickly.
Please tell us about the IV vitamins. What type of different ones do you have?
Well, I mean, there's the standard ones. And you can individualize it to the patient. But for example, during COVID, I had my friends and myself, and I offered to my patients to do IV vitamins because it's good for, zinc, et cetera, as you all remember.
Yep.
But for example, people with like fibromyalgia or multiple sclerosis, a lot of these autoimmune disorders also have GI issues. Even think about ulcerative colitis and Crohn's.
Right.
Right? They don't absorb nutrients well in their gut. So if that's the case, then I recommend either sublingual or intravenous or even intramuscular, but somehow get them their vitamins and nutrients in, because they're not getting it the way we typically should get it in.
Yeah, I can vouch for that. I did IV therapy during COVID. I thought I was going to get sick, and I did that, and within 2 hours, I think, I was like, wow, I'm a new person.
Oh, if you get a flu, it's good because it's just a quick fix. It's in a way it's a quick fix, but it's not. It's giving you nutrients.
Sure.
When you got a cold or you have autoimmune disorder, your immune system is weak, and you need vitamins and nutrients to help your immune system to fight off either the acute issue or the chronic issue. So it's always good to have. Yes, it can get a little bit pricey, but you got to weigh, your health versus the cost of it. I tell people, like tell men who are overweight and have back problems, I go, you go bowling? I go, yeah. I go, well, you ever throw a 13-pound bowling ball? Of course. Well, you got 2 of those sitting on you. I go, what do you expect your back and your knees to do? So you have to change your diet.
Yeah.
They go, well, I don't want to pay because the insurance won't pay for that. So I said, but it's your health. I go, it's 2 chicken wing dinners, at a football game. But if you look at it that way, or I tell people, like, if you miss a day of work because of migraine, that's a big salary and it's a hassle. And now, so you have to find out in the medium, and I respect people how they do that. So that's why it's not just a disease; it's a person who's afflicted with a medical problem. And if you look at it that way, it makes it more manageable and it's more time consuming. But it's taking care of a person, not taking care of a disease.
Right.
So.
Would the IV therapy, any particular one, help with migraines?
Yeah, there's several that you could do.
Yeah.
So that's interesting.
Nice.
And also during the acute phase, you can sometimes do it. So instead of going to the emergency room, to get medications, they'll come to my office, or I'll tell them just get the IV, because when you're throwing up, for example, when you're having a migraine, you don't absorb pills well. So a doctor may prescribe an appropriate migraine medication to get rid of it, but because it's pill form, it doesn't get absorbed, so it sits there. So there's intranasal formulations, intramuscular.
Oh, good.
So, but if you don't ask that question, you don't know.
Right.
And the patient didn't know.
Right.
Right? They just said the medicine's not working.
And how many of us are walking, I'll say yes to me. I know I've walked around dehydrated and not realize, I'm like, oh, I have a headache. I think I'm dehydrated. And, everything helps, I guess. Right?
Right. Exactly. Every little bit can help, depending. So everyone's unique.
Right.
I mean, we all know now what a migraine is, But your migraine presents differently than somebody else's, and you have what we call different triggers. So wine may set yours off. Someone else may be peanuts, you know.
Oh, wow.
Yeah. So I tell people, I had one patient once said, oh, I said, red wine's your trigger to set off a migraine. Comes back a few months later, I go, did you stop drinking wine? He goes, no. He goes, now I know, but I like red wine. So I realized that my own little study or theory is that the higher grade wine, red wine,
Yeah.
is less prone to giving you migraines than the
Wow.
cheaper one because of the tonicity of the grape.
Interesting.
Now I can't hold that true for everyone,
Right.
but
Yeah, everyone has a
Yeah.
different experience.
right,
Right.
like gluten. Like I try to tell people to go on a gluten-free diet, which is very difficult.
Yeah.
But wheat is a big culprit, especially processed food.
Oh, yes.
For people with autoimmune disorders, migraines, it really is. It's not natural.
Yeah.
It's really not a natural food product. But yet we see it all the time when we eat it. So I say, try not to eat any wheat. You know, try and cut that back, and you'd be surprised how much that helps for people with autoimmune disorders.
Yeah,
It really does.
Seems to be a lot lately. I'm hearing more and more about gluten. So I feel like the companies are making more varieties of options of gluten-free items that
Right.
maybe a little better than what
And-
they were years ago.
And soda. I spend 10 minutes telling patients, now stop to drink soda. Because it has, not only does it have caffeine in it, but it has chemicals in it and artificial sweeteners.
Yeah.
So I like that the FDA,
true.
the FDA said, oh, we're not sure if it causes cancer or not,
Yeah,
right?
I know.
But it has complications. In Europe, they banned it.
Yes, they have.
Right.
Totally.
Because it's bad for their rats.
Yeah.
But here, so I get them off, if there's anything that says aspartame, artificial
good,
sweeteners.
good.
I mean, anyone who has any chronic illness, but even just for good health,
Yeah. Yeah.
you should not drink sodas.
Absolutely. Dr. Jeff, we have like 30 seconds left. This has been a great interview. Time has flown. Do you want to share anything with the audience? Any last minute, anything you want to tell them to go see you? You got 30 seconds.
Oh, thank you. Well, like I said, I'm a neurologist, so I call myself a medical electrician. Whether you have migraines, Alzheimer's, Parkinson's, or it's basically symptoms. If you're dizzy, if you have chronic pain, acute pain, you know, that's what I do.
Absolutely.
So-
Thank you so much. Make sure you visit him. I'll give you his number again, 954-900-6699. Thank you so much for coming to the show.
My pleasure. Thank you for having me.
Absolutely.
Good talking
Thank
to
you.
you.
It was great.